History. Cerebral palsy, known as cerebral paralysis, first identified by English surgeon William Little in 1860. In 1895, Sigmund Freud suggests that difficult birth was not the cause but only a symptom of other effects on future development. Introduction. The word cerebral paralysis from the Latin word cerebrum means affected part of the brain. The word palsy from Greek word para means behind and lysis means loosening or lack of muscle control. Cerebral palsy, it is a motor disorder. The condition involves disturbance of sensation, perception, communication, cognition and behavior, musculoskeletal problems and epilepsy. Cerebral palsy is a group of permanent disorder of the development of movement and posture causing activity limitation. Causes of sleeping. First one, prenatal, year, prematurity, low birth weight, maternal epilepsy, hyperthyroidism, multiple pregnancy, drug abuse. Infections. Incomplete cervix, placental infection, insufficient, severe toxemia, eclampsia, trauma, bleeding in the third trimester. Perinatal, prolonged and difficult labor, premature rupture, presentation anomalies, vaginal bleeding at labor, bradycardia, hypoxia. Postnatal, CNS infections, hypoxia, seizures, coagulopathies, neunal hyperbilirubinemia, trauma. Signs and symptoms of cerebral palsy. Physical signs: poor head control after 3 months of age, stiff or rigid arms or legs, pushing away or arching back, floppy or limp body posture, cannot sit up without support by 8 months, uses only one side of the body or only the arms to travel, clenched hands after 3 months, leg stationary, sensory impairment, hearing, vision. Behavioral signs: extreme irritability or crying, feeding difficulties, little interest surroundings, excessive sleeping. Symptoms of cerebral palsy: muscle tone, movements coordination and control, reflexes. Types of cerebral palsy: spastic cerebral palsy, cerebral cortex, dyskinetic cerebral palsy, basal ganglia, ataxia cerebellum. Mixed types: rigidity and tremor, extrapyramidal system. Spastic cerebral palsy. Spasticity means stiffness or tightness of muscles. Depending upon the affected part of the body and by the nature of its effects on muscle tone and movement, spasticity cerebral palsy is further divided. Plasia means to strike. Here two types, monophasia and hemiplegia. Only one limb is affected, monophasia. Upper and lower extremity on one side of a body, it is hemiplegia. Diplegia, 4 extremities, legs more affected than arms. Quadriplegia, 4 extremities plus trunk, neck and face. Triplegia, both lower extremities and one upper extremity. Double hemiplegia, 4 extremities, arms more affected than legs. Here are the examples. Dyskinetic cerebral palsy. Injuries to the basal ganglia can result in atheroid cerebral palsy, which causes involuntary muscle movements. It divides in two types of movement problems called dystonia and arthrosis. Injuries to the basal ganglia also can result in dysautonomia, which causes fluctuating the muscle tone. It is called dystonia. Next, athetosis. Here we go. This is the word used for the uncontrolled extra movement that occurs particularly in the arms, hands, feet and mouth surrounding. Ataxia. It is the least common type of cerebral palsy. Ataxic is the word used for unsteady shaky movements or tremor. Children with ataxia also have problems with balance. Injuries to the cerebrum can result in ataxic cerebral palsy, which causes poor coordination. Mixed types. Many children do not have just one type but a mixture of several of these movements patterns induced to multiple brain areas, usually the cerebral cortex and basal ganglia. Tremor and rigidity. Like athetosis, tremor and rigidity is the result of injuries to the extrapyramidal system. Tremor is sometimes detected at the early age when the whole body shows involuntary vibrating movement of irregular nature. Exceptions. Some children with CP cannot be fitted into these groups because they present with many different impairments. They have low level of motor activity, are slow to make balancing response and may not walk until 30 months of age. Treatment. Therapy can help a person with a cerebral palsy to enhance their functional ability, and therapy is chiefly symptomatic and preventive. Treatment includes physical therapy, occupational therapy, speech and language therapy, recreational therapy, pediatrician. Physical therapy. It can help the child's strength, flexibility, balance, motor development and mobility. Occupational therapy. It works to promote the child's independent participation in daily activity and routine in home, school and community. Speech and language therapy. Pathologists can help improve the child's ability to speak clearly or to communicate using sign language. Recreation therapy. This therapy can help improve your child's motor skills, speech and emotional well-being. Pediatrician. Doctors with special training in child development and in evaluating children developmental problems. Physiotherapist. Exercising the muscles before and after surgery or without surgery is the responsibility of the physiotherapist. Surgery for cerebral palsy. Assessment. P. Poor muscle control. O. Oropharyngeal problems. S. Strabismus. T. Tone. E. Evaluation, maldevelopment or reflexes. Poor muscle control and strength. Test hand strength by lifting the child off the ground while the child holds the nurse's hand. Observe presence of limbs deformity if infant back bend backwards and indicate CP is severe. Oropharyngeal problem, speech, swallowing, breathing. Strabismus, hypotonia, rigid, tense. Hypotonia, floppy or flaccid. Evolution maldevelopment. It delays in motor skills such as rolling over, sitting, carving, and walking size for age. Persistence of primitive reflexes fail to develop. A persistence reflex has been associated with cerebral palsy and intellectual disability called reflexes. Respiratory difficulties, difficulties in swallowing, low activity levels, blocked airways, and inability to cough are among few reasons that children with cerebral palsy may experience. Speech impairment. Many children with a cerebral palsy have a motor speech disorder where the muscles of a mouth may be affected, which makes speech difficult. Apraxia is another common motor speech disorder that affects children with cerebral palsy. Oral motor impairment. Children with cerebral palsy often have impaired oral motor control, which means they have difficulties. Digestive issues. Structure change in the system of children with cerebral palsy may lead to long term of digestive issues including constipation, vomiting. Vision impairment. Up to 1 in 10 children with cerebral palsy have severe visual impairment. Up to half of the children with spastic cerebral palsy have a strabismus, better known as cross eye. Overall, as many as 75 to 90% of children with CP have a vision impairment. Hearing impairment refers to any degree of impairment of the ability to hear a sound. People with any degree of hearing loss for mild to profound, including those who are deaf and those who are hard of hearing. Epilepsy or seizures. According to the Centers for Disease Control and Prevention, around 35% of all children with cerebral palsy will experience epilepsy. It is a brain disease. Ventricular leukomexia. It is a form of brain damage that affects the white matter of brain, resulting in the cells in the white matter of a brain either decaying or dying. Causes of ventricular leukomexia: having twins, umbilical cord inflammation, lack of oxygen to ventricular area of the brain. Symptoms: difficulties with coordination, intellectual and cognitive impairment, vision problems, hearing impairment. Diagnosis: ventricular leukomexia. Medical professionals should take a complete medical history and conduct a physical examination. Cranial ultrasound. This follows them to view the baby's brain through the fontanelle or soft spot between a skull bones. Magnetic resonance imaging. This can show a detailed image of internal structures. It may reveal some of the early abnormalities in babies with PVL. Treatment and prevention. Delaying premature birth or preventing decreased oxygenation during an inevitable premature birth of a baby. Some research has found that when a mother is giving a steroid breathemate during a pregnancy,